In the last 10 years, I think there's much more attention to the global cancer problem, starting with a number of publications, a number of evaluations of the high incidence of cancer in low and middle income countries, and the great equity gap between the high income countries and low and middle income countries, and the opportunities for improvement. We have witnessed great improvements in higher income countries, and closing the equity gap that exists in a number of countries. In our own, in Canada, there's been great progress in cancer control planning and cancer treatment delivery, but have the things improved in low-income countries? Probably not yet, except for maybe isolated examples of creating effective cancer institutes and improving access to very small proportions of population. So there are examples that it can be done. So the question is how we can scale up these small efforts that have proven, sort of almost the pilot project, an example to see that things can be done. I think we need to simplify cancer. I think we need to give an impression that we know how to do it. There's a lot of knowledge we now have to apply. I think we shouldn't be afraid to develop new models of care, to use modern technologies, to do things differently. And I also think we need to invest in the new generation of people, knowing that scaling up cancer control will take 20 to 30 years. We need to engage younger generation. We need to give them a direction and show them that engagement in global cancer both is fun, productive, and important. I think that we shouldn't be afraid of the complexity. The population as a whole embrace new technologies. We shouldn't be afraid to do that in cancer and in healthcare. I absolutely hate the assumption that cancer is too complicated for us to act. In fact, probably cancer care and control is much less complicated than running the infrastructure in Mumbai or London or Manhattan, running the city infrastructure. It must be far more complicated. And in the last year, there was a high-level United Nations Commission looking at health employment and actually emphasizing that this is a very steady source of employment, interesting jobs, the product is healthier people, and it actually improves the economies. So I absolutely love the discourse that investing in healthcare produces economic benefit. These positive bits of information and evidence should be very helpful in scaling up the effort in cancer control globally.